Hey, this is Dr. Ben Pearl with FitFootU. Today I'm here with a colleague, Dr. Alan Block. He recently moved from the program at Ohio State, and now he's got a joint practice in South Carolina.
In Florence, South Carolina.
Yes. I always have known that Alan's done a lot of vascular support work for limb salvage. So here's the question at hand that I have for you. We refer a lot to vascular interventionalists. My question to you is, they do help us get through that critical period in the wound healing to heal that ulcer. Do you feel there's times when maybe the ulcer is not there, we sense that there's some vascular deficits, that there might be overutilization with our vascular interventionalists? That's the first question.
It's a great question, and I have a great answer, I think.
Okay.
So I've kind of gone from the model of why do I have to wait for the ulcer to evolve? So the patient comes in there for, let's say, a diabetic foot check, and I realize they're vascularly compromised. Now, my next move is I don't do lab testing in my office, never have, but I've always sent to a lab. And that lab is predicated on the fact if they find something, they upscale the next test to the next test, and then they're calling me as well as sending to the interventionalist, right? Or the vascular physician, period, who either I want or they feel is best suited for this. And that makes it seamless. So the thing is, I want to prevent the ulcer before it ever happens. So a patient, for instance, who is suffering but don't know they're suffering, right? They may be neuropathic for one reason or the other, mostly diabetes as we know. Why do I have to wait till that patient breaks down before I'm treating the ulcer? Let's treat the ulcer beforehand. It's, again, the stage 1 cancer as opposed to stage 4. Why do I have to wait till it's full blown and I have to put the patient through a lot more now than they could have had earlier on? So I let the interventionalists make that, and if they incorporate me in it, that's great. I hope they do. But my biggest appreciation from patients is not the guy I cure of the ulcer, it's the guy I keep from getting the ulcer.
Not to cast aspersions on any of your colleagues, but now you're integrating into a new community. You were very dialed into your previous community.
Yes.
I'm sure you've had cases where, let's say they've seen several doctors, maybe something hasn't been done. What has been your idea of communities that may not be as dialed into, and what are you going to try to do about it?
You know, it's interesting, when I lived in Columbus, I would have people drive 3, 4, 5 hours to come see me at a consult for their vascularity. They're at a vascular problem. I am not a wound specialist. I do wounds, don't get me wrong. I'm a podiatrist, and they were looking for vascular physicians. And they would drive so I could refer them instead of calling me. Now, somebody's willing to drive 4 or 5 hours, obviously, is on their last leg, literally. Sorry about that. Where I am now, they drive to a much smaller community. I went from 2 million people to a community of maybe 15,000. So much smaller, but they drive from all over. And one of the things that's happening is there's no seamless system for me at this point. So when they come in, we're trying to educate them, and we're trying to get this all set up. And the problem is it's not seamless. So they're asking for me to direct them, which is not the proper for me as a podiatrist. So we're in the process right now of doing the same thing. So we're trying to find out physicians who can treat these patients earlier on. And again, if they need to be treated, if they just need to be tested, right? And that's really what we're looking for. Because we've been doing this for 20 odd years. You know, that when they first came out with, back in the Silverhawk days in 2000, in the early 2000s, we started doing this, they were opening the superficial femoral artery. And now we can go below the knee, and they can go retro, and they go through the foot, right? And they can go through the arm. There's unbelievable things they're able to do. But it took time, like you saw earlier, with what we were talking about in the medicine part of what we just did. But what's happening here is, I don't think we're doing too much early intervention, or it's being done. I think we're realizing the benefits of keeping the patient healthy from the beginning.
Last 30 seconds, I'm going to throw this at you. So I was talking to you in the break room about an article I wrote called Small Ball. It was about little steps we can do to do fall prevention. Brushing your teeth standing on one leg in the middle of the morning. For like our aging population, we reduce our cognitive, our balance, our equilibrium. You now have also discovered some things that you're thinking about for your health and more general. What's some of your ideas about testing that might be applicable for early prevention, silent hazards?
Well, you know, I listened to 2 podcasts, Sinclair and Huberman, and they're both geneticists, one at Stanford, one at Harvard, and they talk very factually. And what they were talking about is the way we should be treating molecularly, not just going to the doctor. Because I go in for my physical, he takes my blood pressure, asks me how I'm feeling, does a few little things. But if I ask for something, say, are you having symptoms? And I'm like, no, but symptoms are the last thing a lot of times to show up. So what they're advocating, which I believe in, is very simply molecular testing, and that is looking for markers earlier, so before it becomes a full-blown problem.
Entity, yeah.
Or an entity, or takes on a life of its own, and then takes my life away in doing so, I'm getting it earlier. So it's as simple as blood tests, which again, as a podiatrist, I can show you, I can tell you what to do, I can draw your blood for you, but this is just a way of looking into health at a molecular level.
All right, now the hardest question. How are the Buckeyes going to do this year?
We're going all the way.
All right, till next time, Dr. Ben Pearl with Fifth You. Thank you, Alan.